Hello dear students, let's discuss a very important topic, that is CSF Rhinorrhea. Okay, many a times this question comes in our exams as long question or short note also. A part of the whole topic will be asked in a short note like management of CSF Rhinorrhea or what are the relevant investigations of CSF Rhinorrhea. Okay, so let's discuss each one of them. So before going into the details, what is CSF rhinorrhea? Basically, as we all know, rhinorrhea means nasal discharge and CSF means cerebrospinal fluid. So it is simply the leakage of cerebrospinal fluid through the nasal cavity. Okay, what can be the causes of CSF rhinorrhea? Most common cause will be trauma, that can be penetrating or blunt injuries, and skull base fractures. Other few important causes are iatrogenic, that is condition arises after any kind of surgery, such as most commonly endoscopic sinus surgeries or any kind of skull base surgeries. There can be certain neoplasms also, and a few other congenital conditions such as meningocele or meningoencephalocele or congenital hydrocephalus can also be a cause. Sometimes it has been observed that polypoidal mass of the nasal cavity can also cause CSF rhinorrhea due to erosion, and cystic fibrosis can also be a cause of CSF rhinorrhea, and few times it has been seen that the cause is unknown. Okay, so that lies in the category of idiopathic cause. Okay, so these were the list of few important causes of CSF rhinorrhea. Okay, so now coming to the symptom profile of CSF rhinorrhea. So there will be persistent, clear, colorless, odorless, watery type of discharge. Okay, the consistency will be serous or water-like, and why? Because there will be no mucus or any kind of protein in the discharge, so it will be not thick, and if it is watery discharge, it will not stick into the handkerchief or any kind of cloth. Okay. Also, it gets aggravated by head bending or any kind of a strain or exertional movement. This discharge is watery in consistency, so it can't be sniffed back just like normal mucoid discharge. What are the other symptoms? There will be headache. Why there will be headache? Because of raised intracranial tension, and at times when infection will be there, it may lead to the meningitis, so that will also cause headache. Patient can also have anosmia or hyposmia, that is loss of sense of smell or reduced sense of smell. So these will be the symptoms of CSF rhinorrhea that will be commonly seen in a patient. Okay, so if a patient comes to you with all these symptoms, take a thorough history. Is there any history of trauma? Is there any history of nasal surgery? Any kind of allergic symptoms patient have? Now coming to the examination part, we have to do the nasal examination. By the nasal endoscopy, we will see the site of leak. Okay, we have to identify the site of leak from where the clear colorless fluid is coming out. Okay, also on examination there will be few important signs, so these are very important. First is reservoir sign. What is reservoir sign? After sleeping overnight, whenever patient wakes up in the morning, there will be sudden gush of clear fluid coming out from the nasal cavity. Okay, when head is leaning forward, so that is the reservoir sign. Second is the halo test, or it is also known as target sign or double ring sign. In this sign, what happens? Whenever the nasal discharge is kept on a blotting paper or a filter paper, it will be seen eventually two rings will be formed. In the center, there will be a blood stain, and surrounding area there will be clear fluid. Okay, so that is the double ring sign. Why it happens? Because there will be difference in osmolarity of both the fluids, that is blood and CSF. In the center there will be blood, while surrounding area will be clear fluid, that is CSF. So there are two rings. It is also known as double ring sign or halo sign or target sign. Here we can see in these two images, first is the halo sign or double ring sign or target sign, where we can see the central blood while surrounded by halo, that is cerebrospinal fluid. In the second image, it is the dripping of CSF. It is not exactly the reservoir sign, because in the reservoir sign there will be uh, flow of CSF in form of a gush of fluid. So here it is not the gush of fluid, but it is just to indicate you guys that how the CSF looks exactly. It looks like a drop of water. Okay, so it is not the typical picture of reservoir sign, but this is how the dripping of CSF from the nose looks like. So these are the two classical pictures of CSF rhinorrhea. Another important test, that is handkerchief test. What happens in this? The clear colorless discharge, that is watery in consistency, whenever that discharge is put to a handkerchief or a cloth, it will not stick to that handkerchief. Okay, it will make the handkerchief wet throughout. Okay, while if we place the nasal discharge on that same handkerchief, it will stick to the cloth of handkerchief. Okay, so that is the difference. Why the nasal discharge sticks? Because there is presence of mucus and albumin in it, while in case of CSF it will be clear watery fluid, so it will not stick to the handkerchief. Okay, so this is also important test. Also, we have to do an routine ophthalmic examination to rule out papilledema. Okay, now coming to the investigation part, what we have to do in case of CSF rhinorrhea patient. First of all, we have to do a nasal endoscopy. Why it is important? To identify the site of leak. Most common site of leak is lateral lamella of cribriform plate. Few other important sites are also there, such as frontal sinus and sphenoid sinus leak, but most common site is cribriform plate. Okay, there are certain characteristics of the cerebrospinal fluid. That is, first of all, beta 2 transferrin. Okay, it is a protein present in the cerebrospinal fluid. Testing of beta 2 transferrin is very highly sensitive and highly specific. Okay, so it is almost a confirmatory biochemical marker for the CSF rhinorrhea. Very less quantity is required for this test, as only 0.5 ml of CSF is required for this test. Okay, so it is very important. Most sensitive and most specific test or biochemical marker for the CSF rhinorrhea is beta 2 transferrin. There is another protein that is not characteristic of CSF but is important, that is beta trace protein. If its concentration in the fluid or the discharge is more than 2 milligram per liter, it is confirmatory of the CSF rhinorrhea. Apart from these biochemical tests, we can also go for radiological investigations such as CT brain or CT cysternography. There is a dye test that is known as intrathecal fluorescein study. What we do in this case, we will inject a dye named fluorescein. We will take 0.25 ml of 5% fluorescein dye and we will dilute it with 10 ml of CSF. Then we will inject it from the lumbar puncture. Okay, when we will inject this, and we will order the patient to stay in a Trendelenburg position. Okay, so after some time the dye will be detected in the nasal discharge. Okay, so that is the basis of test for intrathecal fluorescein. Apart from that, we can also do chloride estimation in nasal discharge. If the concentration is more than 120 milliequivalent per liter, it will be confirmatory for the CSF rhinorrhea. Also, we can go for MRI brain. This is an image of intrathecal fluorescein dye test that I have explained just now. Here we can see it is nasal endoscopy image. A metallic section is introduced and there is septum and inferior turbinate. Between those, the nasal discharge, which is stained in a green color, that is the fluorescein dye. So basically this is the depiction of intrathecal fluorescein dye test. And now coming to the management part, how we can manage the CSF rhinorrhea case. So first of all, we can go for a conservative management. There are different indications for conservative management as well as surgical management. When we will do conservative management, if there is any small leak, okay, the leak is in very small quantity, or if there is immediately post-operative CSF leak is suspected, okay, or if a patient belongs to older age group, then we can go for conservative management. So how we will do it? We will advise the patient to do maximum bed rest with propped up position. Means the head end of the bed will be elevated approximately 30 degrees from the flat line. Okay, also we can advise patients prophylactic antibiotics. It is important to prevent ascending infection, and if there will be ascending infection, that will lead to meningitis. If there is no resolution of symptoms or no resolution of rhinorrhea, after these management, then we will advise the patient for the lumbar drainage. Also we can give some drugs, that is acetazolamide, the brand name is Dimox. Okay, and also we can advise laxative, so that patient can avoid straining while defecation. Also patient has to avoid coughing, violent sneezing or violent nose blowing, and heavy weight lifting. So these all are the part of the conservative management of CSF rhinorrhea. Okay, now coming to the surgical management, what are the indications for surgical management? If there is failed conservative treatment for 2 weeks, or if there is associated fracture, any kind of trauma to the skull base or nasal bone fracture or any kind of injury, then we have to avoid the conservative management as much as possible. If there is pneumocephalus, then we have to avoid medical management. Why? Because pneumocephalus is a emergency condition. We will discuss further. So surgery is necessary. Or if there is brain herniation from the defect, then also surgical management is very important. So now what are the options of surgery? Let's discuss. Okay, so now coming to the surgical management, we have to identify the site of leak. As we have studied, the most common site of leak is from cribriform plate. Okay, so now the closure of the defect of cribriform plate is usually done with a layer of fat, and with the layer of fat there will be a septal cartilage that is used most commonly as a strut, and over that strut temporalis fascia is used as a graft. Okay, so it can be used in underlay or overlay fashion in any way. So this is the most common modality of repair of defect of CSF rhinorrhea. Other than temporalis fascia, there are few other graft materials also available, such as nasal atrial mucosal flap, or we can use septal mucoperiosteal flap, or at times we can also use middle turbinate as a flap. Okay, so these are the graft materials for the repair of defect of CSF rhinorrhea. Okay, so if there is leak from, let's say, sphenoid sinus, so we can access that also from conventional endoscopic approach. As sphenoid sinus CSF leaks are best approach endoscopically. There are other routes also, such as external ethmoidectomy, or we can go from sublabial transseptal approach. Okay, or we can also go through craniotomy. Okay, when the defect will be greater than 2 centimeter, then we can do craniotomy also, or for the endoscopically inaccessible defects. So that was all about the CSF leak from the sphenoid sinus. Now coming to the complications of CSF leak repair, what can be the potential complications? Most important is meningitis. It will happen because of ascending infection through the defect, or there can be pneumocephalus also. What is pneumocephalus? It is collection of air in the cranial cavity. Basically air gets trapped in the subarachnoid space. Okay, so when the air will be trapped in the subarachnoid space, it will lead to the various symptoms, such as sudden change in mental status, alertness, or there will be severe headache, and patient will have nausea, vomiting, and neurological deficit can also be there. Okay, so that is a very important complication, pneumocephalus. It is basically a clinical emergency. We have to manage it at priority. And apart from that, we can also see brain abscess in few cases. Again, the cause will be infection. There can be intraoperative hemorrhage also due to injury to any major vessel, or there can be postoperative sinusitis or granuloma and scar formation at the site of repair of defect. Okay, so these are the few potential complications which we can encounter during CSF leak repair. So now coming to the common sites for iatrogenic injury that happens during endoscopic sinus surgery. So the most important site is lateral lamella of cribriform plate, or we can say ethmoid roof or fovea ethmoidalis. And apart from that, there are other important sites such as posterior wall of frontal recess and the superior attachment of uncinate process, where it gets attached to the skull base. So these are the few common sites for intraoperative damage that will cause the CSF leak. So that was all about the CSF rhinorrhea, its important causes, investigations and management, and its complications. So uh, just revise this topic thoroughly, and it is a very important topic from exam point of view. Many times short note and long questions comes in the exams as well. So follow this channel for more such contents. Thank you.